So thank you all for being here and joining us in this session of the eHealth Summit Portugal. We are very happy to have this session on digital health skills, and we believe that education is the way forward to improve digital skills and finally the health of our population worldwide. So we have a worldwide panel here, and it's really a pleasure and an honor to have you with us today. We hope to meet you personally in Portugal in next year. So we will begin straight away with the Professor Thomas Lindgren from the National Medical Officer and National Board of Health and Welfare in Sweden. Please, Professor Thomas.
Thank you, Juliana, and thanks for the invitation to this exciting conference. We know that digital delivery of healthcare is expanding all over Europe and all over the world, and the scope of this will be presented elsewhere in the conference. But I would like to make a few highlights from what's happening in my own country. We have a healthcare system where the government issues regulation of healthcare and also guidelines, but the municipalities, the regions in the country are the ones that provide actual healthcare. So we need a collaboration between government and the local authorities in order to improve healthcare, also when it comes to digital healthcare. And we have together formed a vision about e-health by 2025 with very ambitious goal of how to expand this in a way that best serves the population. Also, for instance, we are a country which is very sparsely populated, and we have very vast rural areas outside of the big cities. We have instigated a Center for Rural Medicine, that is to research and develop better means for developing high-class healthcare in very remote areas. In those areas, people may travel for a whole day by car in order to reach the nearest hospital or be flown in by helicopters and so on if it's urgent. And here, there is a focus of a multitude business-to-business solutions where have been developed rather than end user or patient-centered solutions. For instance, a doctor or a nurse at a rural healthcare center has access to certain connected clinical rooms with equipment for demonstration or remote monitoring of vital parameters that can be communicated in real time with a hospital specialist. Thus intervening with the need for the patients to be moved to the hospital to receive high quality care. My own agency, the National Board of Health and Welfare in Sweden, was commissioned by the Swedish government recently to produce recommendations for which type of care and treatment that is appropriate to be handled remotely by digital care services and which ones are not. And that scope was for patients, for services that aim directly to patients. And we have stated some overarching principles for which types of care are suitable and not for that. And we have a report that you can obtain from my agency as well if you're more interested. But in order for care and treatment to be suitable for digital care services, the following principles must be met. The current statutes, regulations, and current knowledge management do not require a physical meeting, and that's important to exclude those meetings from distance or digital services. And also the digital service must be adapted to the individual patient's needs and conditions for using the service. So the patient must have a certain degree of digital literacy in order to make a visit digital. And also it's important that the caregiver has access to sufficient information about the patient's health conditions and medical history in order to be able to provide good and safe healthcare. And of course, the ideal is that you have digital services to patients that you already have met and have examined physically. But in other cases, you must really have good access to enough information. And not the least, it's important to have means for follow-up and coordination with other actors. So it's strongly advised against so-called fire and forget solutions in digital healthcare. I would also like to provide some thoughts about what to think about, especially when you transform into digital. And one thing is that transformation is a really good opportunity for other kinds of business development. And do not miss it. Do not just transform the ordinary healthcare that you provide physically into the digital format, but see how you can provide better care by using digital means. Also, it's important to include users already in the design processes and the development processes. Do not miss that. And also remember that there are users in both ends of the tool. So you have to consider both and test by real patients that it's really as usable and user-friendly as you think it is. And also do not forget to include the professionals in the development processes because they have to be familiar and safe with using it. And also when the services are up and running, you have to have real-time digital support. So you have to think about how to support the users when they use the tools after they are introduced. Also, you have to think about how you treat and meet the patients, and maybe the formats are not the same, should not be the same as they are when you have a physical meeting. You may have to think about the language you use. For instance, if you chat with a patient, you should not use the formal language that you have used in letters before. So you have to be more personal in your combination, although not private. So you have to really think that over so it lands correctly with the patients. And you have to customize, adapt to the individual patient when you communicate. So do not use the templates that we have in information leaflets, that information to all that suffers from and so on. You have to individualize, because that is what patients expect when you have digital formats. Also forget your preconceptions about which patients that can and cannot use digital solutions, because you will encounter 90-year-olds that expect to be offered to use digital tools, and you will encounter 20-year-olds that are very unfamiliar with them as well. And then for the last, forget about AI. It's a lot of buzzwording about AI nowadays. It does not exist. It will not for many years. So focus on automation, about repetitive and administrative information, to grab information from one system and automatically insert them in another, to have patients to pre-fill in information in information systems and so on. So automation is the strongest way forward right now, and AI maybe in the future, maybe. So that was a little bit of thoughts from me and from my country about what's going on right now. Thank you.
Thank you so much, Thomas. We will have time for discussion at the end of this session. So now I would invite Professor Carl Josip, which is part of the WHO Collaboration for Digital Health and also part of Nanyang Technological University in Singapore.
Once again, welcome. Thank you for the invitation, honor and privilege to be with you at the eHealth Summit virtually, but with my thoughts and heart in Portugal today and in Bali in Singapore. And I just want to say how timely, how important this topic is. There's always this sense that this is the most important topic for any topic that is raised. And I may be seen as someone who has a special interest in digital health due to my research and clinical work. But genuinely, when we see before the pandemic, most experts would agree that one of the biggest transformations in healthcare that needs to happen when we compare it to other industries, and I won't list all the industries that have been transformed through digitalization, through digital transformation, healthcare was not yet seizing the full potential. And as the pandemic came, I would say our pendulum almost went too far. And certainly now we had, if I give you perhaps anecdotal evidence first, I have, we all talk to colleagues from different countries, we check how things are, and I spoke to, oncology surgeon in US who said, previously I might see 1% of patients remotely. Now, in oncological surgery, where I never thought I would, I'm seeing 60–70% of my patients via video consultations. I'm doing telehealth and so on. And I could give you countless examples from other specialties and other countries where similar trends have happened in a very short period of time. And this has brought really to the attention of everyone, are we, and when I say we, mean both health professionals, as well as patients, carers, public, population, are we really ready for that? Are we equipped with skills, with competencies to do this safely, effectively, to make the right choices? When is it good to do it and when is it not? And so we have, before the pandemic, been working on this, and I have a few slides that, if you wish, I can share on the topic. So just a moment and I'll bring them up. So when we think about the digital health and the potential, then the first thought is that when we look at the WHO projections, we see that the world is today, and that was before the pandemic, 18 million health workers short. And if you think, what is this number comprising of, then let me tell you that just doctors is over 3 million. Nurses is over 8 million. And again, to say, we have a problem. And this problem was compounded by the pandemic. But there is also an excitement. And that excitement births from the opportunities that we have seen that digital health has brought, both to the delivery of care, as well as the digital education that has been there from, we could say, almost kindergarten, or from primary school all the way to high schools and universities, to continuing professional, continuing medical education and development. Let's focus back to digital health. We've seen some seminal reports in different countries. This is just one example, which have been calling for health workforce to be made ready for the digital future. This is another one from Stanford. And at the same time, it's a small, a relatively small study, but on the right, the font may be too small for you to see, but this was a study done by European medical students, which has shown that they really feel that they lack preparedness. And there would be, many would say, but they are Z, they are Y generation, they are, internet and digital natives and so on. And yet they said, we come into practice or we go into clinical rotations and we feel so out of depth in terms of digital skills. And so we see that it's not just that those who are teachers or those who are in clinical delivery that they feel that, it's also healthcare professionals. I won't stop much on the digital health as definition. Let me just say that there are over 90 definitions of digital health that we found. Here, there's an amalgamation of a couple, you know, the WHO one and FDA one. And more important than definition is that we think, what does this mean in terms of how do we prepare our doctors, not for the future, but for today, of delivering such care? And what should medical, nursing, pharmacy, and other healthcare professionals know about digital health? How should we teach them? What are the competencies? How should that be in which part of the curriculum delivered? And so we did a review of how is this being taught today, and what are the educational frameworks. And let me just give you a few highlights from this. The first is that the majority of schools, and this is evidence from what we could see reported from the scientific literature, that's not necessarily the whole picture, but it's in majority of curricula, it's not being yet taught. It's not in the curriculum. And I would give an analogy here. Some 20, 30 years ago, when consultation skills and communication skills were introduced into curriculum, there would be deans who would say, well, why would we teach medical students how to do communication? Surely they know how to talk. And there is this analogy now with digital health, and we know now that the consultation skills are a very big part of the first, of the second, of the third year of the medical curriculum, nursing curriculum. There's not just about patient-centeredness, about personal approach and holistic medicine, but it's also teaching listening skills and so on. So that same analogy comes sometimes with the digital health. Do we really need to teach them how to use the computers, electronic health records, how to do video consultations? This is all so simple. We know from teaching, because we've introduced this curriculum into our medical school, which is a joint medical school of Imperial College and NTU in Singapore, that the feedback when this year we first time taught from last year, medical students, was very, very positive. Students really appreciated being taught that. They felt that was some of the best teaching that was really applicable to their future clinical practice. Well, let's go to that literature review. We see that where it's currently being taught, it's still quite narrow, and there is a scope for expanding to, whilst I very much agree with my colleague Thomas Lindén when he said that AI is more a hype than yet something that is transforming practice. At the same time, we see some areas, and I'll give an example, machine learning for mammography, where the second radiology reader is now a computer, is AI, and that has been proven that the evidence that it can approach the expertise of a specialist. And then there are some other areas, but importantly, we need to, in this very dynamic field, like the rest of the medicine, our curricula need to constantly evolve. So in the interest of time and being short, I will just finish with a few points. One is, from this work, we see we need to work on learning objectives, and we are now working on an international initiative, and I invite those who will listen to this presentation to get in touch if you want to be involved, on digital health, where we will share with each other expertise, best practice. We have involved chief information officers, chief medical information officers, digital health and digital education researchers, policymakers, and practitioners. How do we assess this? And one example I want to give you is we have OSCEs, so objective simulated patient examinations for a variety of skills. We can bring in assessment of digital health skills, and we need standards around this. There are other implications which we see, and questions around how do we make this integrated rather than a standalone subject. The way we teach this is that when we teach, for example, mental health, we introduce within the mental health or psychiatry also the computer CBT. When we teach about endocrinology or diabetes, we introduce how diabetes apps could be used. When we teach some other subjects around the data science, we combine this with population or public health, and so on. So take-home points are really that we do need to pay attention to this dynamic area, also in terms of teaching, in terms of research, how to best teach it, and in terms of also researching how to rigorously advance the evidence base for use of digital technologies in healthcare. And I will finish on this point, but really going back to the discussion and the points that the other colleagues have raised, and look forward to more sharing from others. Thank you.
Thank you very much for your presentation. And we go straight away to the presentation of Professor Maria Eugenia from the University of Porto Alegre in Brazil.
Hi, thank you very much for the invitation to talk in the eHealth Summit is about this topic that is very, very important nowadays. I'm going to share my slides. Well, I'm talking about an experience we had here in south of Brazil, in Porto Alegre. We are a city that you are known for the quality of the healthcare in private and public health. And in my university, we had an experience to introduce some of these digital skills in the undergraduate in medical school, nursing school, and nutritionists. And afterwards, we expand for the whole university because we have a specialty, because we are a university that has all courses are from health professionals. I'm citating our colleague. Thank you, Joseph, for your article. It was very helpful. And here we have some of the why it's important to develop digital skills at the undergraduate. And in the next 2 decades, the majority of jobs in health will have digital components. And the remote care become a reality with COVID pandemic. And even further, the professionals are digital natives. They require more training. Improving the digital literacy is necessary to qualify our healthcare. We have technology today in almost everywhere. And digital literacy and changing learning concepts, we're not talking more about the teacher know everything. We learn, our students learn anywhere and anytime. And we have a gap between teachers and students about technology. And if you look in the scale of development, we have technology rising up in an exponential, and we have education with a little bit more time to take the step to change. So this is something that we learned in the last year in COVID pandemic, that we need to put practice right away. We have before 2000 few initiatives in the curriculums, and some initiatives is in regular curriculums. And in 2006, our university started a small, very small initiatives to introduce some of digital skills. And in 2020, with the COVID pandemic, we need to accelerate this process. So we see now that we need to implement learning opportunities right away, and we see in the future that we need to masterize this, because otherwise we're going to lose a lot of opportunities to put our healthcare in better quality. What we want students to become in a digital era? Well, we want them to be capable of using information technology, information seekers, analyzers, and evaluators. We need them to be problem solvers and decision makers. We need them to be creative and effective users of the productive tools and become communicators, collaborators, and publishers and producers of material and knowledge. They need to be informed, responsible, and contribute as citizens. But for this to happen, we need to start training teachers digital skills. Otherwise, we're going to have the gap bigger. And some of our teachers are old school, and this is happened all everywhere. So I think that the first step we get to start this changing is start with faculty development. Internet and technology in education are used right. If you use the right methodology, we can engage students effectively, cognitively, and imaginatively. We just don't need for them to take their computers to bring the class instead of books and notebooks. We need them to work with the technology and input that in their learning, and because afterwards they're going to use it in other ways. So we need to teach them how to do it, not what to do it. We start our experience here looking at knowledge and skills and attitudes, and we have the general digital skills. We have the CAMEDS frameworks that works a lot of things that we think that's very important for the students to learn, and have our guidelines and our horizontal learning experience. So healthcare students' digital skills, and this is what we choose to work, was use device and applications, communication, clinical care delivery, work with information for decision support, ethics, privacy, security, and regulation. We start with them, and that's something that we use longitudinally. We don't have we have just one specific point that we work with informatics, but afterwards we try to put this on all the opportunities of learning. So we look for how to use and introduce cell phones as a tool of care, apps, how to use the apps, even though to study, but also to do care. Platforms for teleconsultation and remote care. This was the first thing that we learned in the COVID pandemic, that we need to put on practice. Here in Brazil, we didn't have a law about teleconsultation. So in March of 2020, our medical council, need to rush a law to permit that doctors could do teleconsultations. I think that we were the last country in Latin America, and probably in a lot of places, to have a law about teleconsultations. And this was a very good improvement, because we learned so much in this year that probably this is going to stick. Image, as Joseph says, is very important, and we need to understand how the students and afterwards the professionals we will be using this to deliver care. Health information and records management, they need to learn how to use it. Otherwise, they use as when they are on a primary care unit or in a hospital, and they don't know how to use it correctly. In this way, they lost some opportunities to the care and opportunity to improve and rapidly obtain the results. And this is directly with the data quality. So the input that they put on the records, they need to be with quality. Otherwise, I can use this information afterwards to do planning or evaluations or assessments. So it's important for us, or research, and it is important for us that we qualify the data so that we can use this afterwards. In effective use of productive tools, because otherwise they run around and they try it, and they don't do the right thing, and they start to do it on the wrong way. And this way, we try to bring them to use the better tools to productivity. When we talk about communication, and everywhere we teach communication skills. But when we talk about digital and digital media and everything else, we need to teach them and otherwise learn from them sometimes about use of digital communication. Social media, emails, videos, the way that they came to the university, they use social media as a private thing. It's not the same to use the social media for a private thing and to use professionally. So we need to teach them some skills that is very important. And this came with interpersonal skills and care delivery. Otherwise, our patients will see us in social media, and maybe we can have a difficulty afterwards in the consultations. Communications skills at teleconsultations are different from the face-to-face. We lost, when we are in front of computer, our non-verbal communication. It's more difficult for us to understand what some things that usually when we are face-to-face is easier. So it's important to teach the students to use the telecommunication in a very practical way. Ethics and privacy are the most important things nowadays in the digital area age. Is very important that we talk about ethics and privacy and patient safety. This is topics that we need to input on everything that we teach our students. And production of content, because they can talk to their generation easier than me and easier than a lot of my colleagues. So it's very important that we bring them to our side and bring them to use the skills to produce these contents and be more effective in this way. Clinical care delivery, we are already talk about this, and teleconsultation, remote care, and health prevention are two of the most important things that we have in this digital area age. Information seekers, analyzers, and evaluation is other thing that we need to teach them to use it, and how is to improve their skills in this. And this we can do using in epidemiology or using in another measure that they are looking at. Problem solvers and decision makers, they need to understand where they can have their information. In use of simulations and virtual reality for training and care, this is something that we need to pay attention in the next years. And we have in Brazil, a continental country, remote preceptorship is something that in tele discussions between colleagues is something that we need to start for them in the undergraduate, because otherwise they don't put that on their future practice. Work with information for decision support is something that is very important to try and introduce, especially in a country like mine. We have a public health system that is wide and the one that most employ people from healthcare, health professionals. So this is important that we put these subjects on their learning experience. And not again, health information to qualify the data. This is something that otherwise we're going to have a big problem in the future. Ethics and private and security and regulation about data security policies. We have a very big last year that started in Brazil, and now we are putting that on our disciplines so they understand. We have a lot of things about social media, how to port or how to work in social media and don't expose yourself in your private life and in your professional life. They don't mix.
Sorry, Maria
knowledge
Eugenia,
of
sorry to interrupt you. We are just on time.
Okay. Just one more thing that I think that is very important. We must remember that we are preparing students for challenges and works that probably haven't even been invented. This is something that we need to pay attention in a lot of places.
Thank you so much.
Thank you.
And, Thank you all for your presentation. It was really wonderful, and I think that we can only learn from diversity. We have such diverse experiences around the world, but we all face almost the same problems or very similar problems. So together we can think in better solutions for sure. And I've heard really interesting things. And one thing is from Thomas, that is the need to adapt language to this new way of interaction. And we always think about digital skills as IT or as there's something for engineers, and I'm a physician. I don't really want to know anything about that, but that's not really the core of the question, which is interaction, which is again clinical encounters, and it's people meeting people through any means. So that's a really interesting question. The other thing is, and that's from Carl, that I heard that was really interesting, is that we need to match capacity with necessity. And now we all recognize necessity, but I think that we weren't still able to deliver capacity, and that's why we are here today trying to find new solutions. And the other thing then that was from Maria Eugenia, that was training the teachers. That's absolutely essential to go forward. So faculty development is a really way to go forward. And so now in this session, we looked at this topic of digital skills in two perspectives. One that is from the undergraduate training, that is the start of everything. And the other is how to be able to continuously deliver knowledge and skills to the health professionals. And that's another really important issue, and really sometimes very difficult to approach, because the health professions are so diverse in their daily tasks and so diverse in terms of institutions that regulate their work. So as a final discussion, I would like to ask you, each one of you, maybe one starting point that we could implement right now to go further with this building of capacity for health professionals. What will be the one first measure that you do implement, if you could do it, and maybe you can, that would really change this worldwide landscape of digital skills? Now, maybe we can start with you, Thomas.
Thank you, Juliana. I think for one thing, you should not start with one thing. Simultaneously as we do the technical transformation, we also have to do the sort of mental transformation. So I think we already now should start discussing how we meet patients digitally. And as Maria pointed out also, that it's important to reflect over the ethics, confidentiality with patients, and it's so easy to share information and ask colleagues about information on how to treat patients, and to do that without exposing patients too much is a concern, I think. Also, that you really have, when you have digital services, you have to provide a follow-up for the patients, and you have to be sure that you can refer patients that is beyond your own capabilities. So we have to think about sort of the soft issues as long already when we are developing the technical solutions.
Yeah. Carl, can we hear from you?
Yes. Just building on the point that my colleague Thomas Lindén said, we do need to approach this holistically. This is about, there's an expression that hard things are soft things, and that the soft things are hard things, meaning that we tend to focus on hardware, software, the new device, and so on. But the soft things are like, okay, how does this change the process of care? How do, does the patient know how to use it? And those things are seen as even not so exciting, and perhaps receive not only less attention, but also less funding, less perhaps thought sometimes. And that's where the crux of, if you want, the magic of making it work happens. I'll give an example which is very simple. Pretty much, at least for the last 10 years, if not 12, since the first iPhone came out, people were saying this is the year of health apps. And the health apps will transform healthcare so much. And we hear this every year, and people are already tired of that. And when I look, and it would be interesting to hear about Brazil or about Sweden, but as far as I know, there is practically, you can count on fingers of one hand apps which are part of clinical guidelines, apps which are mainstream, that you have an app in any domain of medicine that you say you have diabetes, or you have depression, or you have this and that. Let me look at which app would be good for you. So apps on prescription or digital therapeutics, if you want a more fancy term, or companion therapeutics, is within our reach. I think those who say that the potential is there, I don't think they are wrong. They are right. But to make that happen, will take a few more steps than just having a really powerful device. And if we focus on that, if we focus on alignment, and sometimes alignment is also funding, but usually funding is not the biggest problem. But I don't want to underestimate, but not also give it too much importance. Training we talked about, and we talked about the digital skills of healthcare professionals, but it's also patients that we need to pay attention to. And not repeating the mantra, oh, the old don't know how to use. In fact, we see among, for example, the Facebook users, that elderly 60 plus are very high users. So a more sophisticated, tailored, personalized, genuinely personalized approach can take us a very long way. And if any doctors will be listening to this session, I would say where they can start today is don't be upset if patients come and say, oh, I've read this on the internet and this and that, and can you tell me something about this? Guide them how to search the internet, how to find the trusted sources of information. And if you're not sure how to do that, then we're developing an e-learning module that you can, it's not too difficult, but there is still some learning for both for patients and doctors. And we know ourselves sometimes it's not quite fake news, but it's sometimes not too far to choose what in medicine, which source to trust and which information is trustful. So I'll stop there. Thank you.
Thank you, Carl. And Maria Eugenia, just for finishing.
Yeah, if I must choose one thing, I would say in the undergraduate education will be create a group work with teachers from every area of knowledge, and start with the early adapters and identify the ones that can help you to put that in the curriculum in a spread way, and also include the students in the whole process, in the planning and the execution and assessment, because they are the native digital ones. And we must understand that they have some things to teach us also, but we need to guide them how to use their knowledge. And we start using here in Brazil the fake evidence, not fake news, fake evidence. because we are in COVID, we have a lot of that. So we need to teach them how to analyze and be critical of what they read on the internet and what they go for in their social media, because otherwise they are just spreading bad news and spreading fake evidence. And this is maybe the worst pandemic that we have nowadays in Brazil. So I think that create your group and they started small and go spreading around all the formation of your students.
Thank you so much. It was really a pleasure to have this conversation, and I really believe that in the future we will meet really more often to be able to keep going with this work. And that's really interesting that we are moving from gadgeting to interaction, and that's really the most ancient and new thing that we have to worry about. Thank you so much for being here today, and looking forward to have you presentially in Portugal in the future. Thank you.
Thank you.
Thank you. And
Thank you. Obrigado.
Obrigada. Obrigada.